Hello, I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery, and I'm here to speak for our organization's public education spotlight for the month of April, which is National Skin Health Month. April is also National Rosacea and Stress Awareness Month. We all want to have healthy skin, which is generally defined as youthful, glowing, even-toned, and smooth. Like many people, you may have bought a lot of creams and used devices such as microneedling, lasers, red light therapy, and oral supplements such as powdered collagen and skin-specific vitamins. In my practice, I spend every day counseling my patients on how to keep their skincare simple and with minimal maintenance. In this video, I'll provide you with some insight about stress and rosacea. We all know stress feels bad, but it's not just a mood. It is a full-body physiologic event. Chronic stress keeps your cortisol levels high, which eventually suppresses your white blood cell response, as well as having negative effects on your cardiovascular system and your gut microbiome. You can develop insulin resistance and even affect parts of your brain responsible for memory and learning. For people with rosacea, facial flushing can be triggered by stress, certain foods, and even exercise. Medical literature now defines rosacea as a neurovascular inflammatory disorder. When you're stressed, your brain triggers the release of neuropeptides like substance P. These chemicals act like a short circuit in your skin, causing blood vessels to dilate and immune cells to go into overdrive. Heat from exercise and chemicals in your food activate TRP channels, your skin's thermal sensors. Essentially, your nervous system is hypersensitive to everything, leading to the cycle of redness and bumps. So what can you do? Well, here are 3 evidence-based strategies. Number 1, manage your thermal load. High-intensity cardio in a hot room can result in a flare. Consider low thermal workouts like swimming or weight training in a cool environment. Keep a cold towel or a fan nearby to reduce heat before the flush becomes a flare. Number 2, de-stress your plate. It's more than just spicy food. Peer-reviewed data points to cinnamaldehyde found in tomatoes, citrus, and chocolate as a major trigger. If you're in a high-stress season, try a low-vaso diet, focusing on cooling, anti-inflammatory foods. Number 3, the 5-minute vagus reset. Since stress weakens your skin barrier, using diaphragmatic breathing or a cold compress in the back of your neck when you feel a spike, this helps calm the vagus nerve and possibly shut down that flushing signal before it starts. From a cosmetic, medical, and surgical perspective, in my practice, as a specialist in cosmetic eyelid surgery and facial rejuvenation, such as facelift surgery, I always evaluate my patients to see if they have hypersensitive skin or rosacea as part of the way I develop a treatment plan for them. For example, for people with lighter skin, I routinely perform fractional CO2 laser to improve the appearance of fine lines and wrinkles, as well as discolorations from sun damage. In some people with a history of hypersensitive skin or rosacea, I may consider a less heat-intensive laser, such as a light fractional erbium laser. We also treat telangiectasias or broken capillaries, as well as vascular flush with special lasers that target blood vessels specifically. Contact us to learn more and have a happy National Skin Health Month.